Okay, good evening, everyone. So thank you so much for joining with us for this 3 days masterclass on naturopathy case taking and prescription making. So this is in continuum with the scientific basis of naturopathy sessions, which we have conducted earlier, some 2 years back. And so many of you have attended from this session. You have attended this particular program, scientific base of naturopathy, and this is a kind of a continuum for that. But I'll try to cover most of the topics which we have discussed last time because it is linked to that particular topic which I have covered in the last time. Okay, and also this particular program is basically organized when based on the practices of naturopathy, which I have seen across my colleagues, where people have been becoming single-centric practitioners. They are going forward and practicing a single kind of therapy-based approach, and there is no philosophy existing in the practice what we are doing. So this particular program is basically designed on the basis of those kind of experiences which I have seen among our fellow colleagues, and I thought like we need to be adding some sort of flavor to the practice what we are doing, and why we are doing case taking and how it is going to influence our prescription making. It's that what we will be seeing over a period of 6 hours across 3 days. Okay, so at the outset, I also would like to thank Madigowda Naturopathy Medical College, Karnataka, for cooperating with us and sending in their students, especially the principal G. Santakumar sir, and Dr. Vibas from Excel Medical College, who was again another support, Dr. Vanita Shetty from Alvas Medical College, who was another support for this particular program, and also the Vedic Yoga Institute, Kolkata, who has also been a part of this particular program. I thank every one of them, and all of you guys. We have got around 435 registrations for this program, and all of you for trusting again and again, us and joining us within this particular program. Okay, and let us get started. I'm just getting some messages from people who have not checked their emails. Okay, so let us get started. And if you are not able to hear the audio at any point of time, I would recommend please rejoin again. Okay, just disconnect yourself and rejoin again. So it may be a network issue. So let us get started. I'll just share my screen. Hope my screen is visible for everyone. Okay, so naturopathy case taking. So the fundamental process in any practice, any medical practice, be it naturopathy medical practice or any system of medicines when we are practicing, the fundamental thing is like how we are operating with our system, or how the philosophy in a system is guiding its clinical practice. So what kind of practice we do as a naturopath, as a yoga and naturopathy physician across India. We have very diverse practices in virtue of our curriculums, in virtue of our practices, the exposure we get during our college days. So this is kind of influencing how we practice or how we take a case. So a diabetic person coming in front of you, every one of us will be treating in a different way based on the kind of experience and exposure we get from our seniors or from our colleges, how we are getting those kind of exposures. Okay, so uniformity is not expected that everyone should have that uniform practices what they should be practicing at a point of time, but there should be some sort of uniformity we should have while we are basically looking at a patient, when a patient is coming in front of us. Okay, so to just take started, why we basically take a case report. Okay, the case report are taken for multiple reasons. Like case report, if you just see what we do in our medical schooling, So we'll be asked to take some cases. So we'll be sent to our clinicals, and we will be just going and taking the case reports in their own way. And we really do not understand why we put certain columns, for example, systemic examination. There are many columns like provisional diagnosis, general habits. These columns we just fill like that as a medical student. So many a point of time, we do not understand that why we are filling this and what is the relevance of this particular form, which is going to help us in clinical practice or prescription making. So usually these case reports, once upon a time, like when you have this case reporting from whatever you are speaking to your patient and whatever you are collecting the data from your patients, the case reports are meant to recognizing a kind of a condition where there is a new or rare disease which is occurring, or to evaluate the therapeutic effects or your adverse events, the cost of intervention, how things has gone through that particular patient, and how a problem-based medical education can be dealt with. So this was a fundamental requirement for a case report. But we all doctors, we have converted this case report, which is typically a kind of a publication format, into a kind of a medical care where we basically limit our exposure based on what we know. Okay, so we always want to make a diagnosis as a doctor, right? Whenever a patient is coming in front of us, and what we look more for is like if a patient is coming with abdominal pain. Okay, so we look into that particular patient more with an enthusiasm to find out what could be the reason for this abdominal pain. And we are so much fascinated by this diagnosis making, and we forget that that particular diagnosis we are making for a patient and what he or she perceives about that particular diagnosis, we seldom understand. Okay, so there is a message. Yeah, the recordings of the session will be provided by the end of the session every day. Okay, so the case reports have a very high sensitivity in reporting novelty and a cornerstone in medical progress. So when you look at a system like naturopathy system of medicine, naturopathy system of medicine is unique in its very own way, especially the practice in India. Because in India, we are not influenced by pharmaceuticals in naturopathy practices, unlike in other countries where you use certain amount of herbals, nutraceuticals, and things like that. In India, we are not very much influenced by this kind of pharmaceutical practices, and we are not having many options in medical practice. Like if you see the kind of naturopathic practice we have a very limited amount of therapeutic options in our hand, and we have to manage our patients with that limited amount of therapeutic options. And at times I see, like I teach in a medical college where I can see my fellow students who are completely lost why they have taken this particular course. Okay, like, and many of you after passing your BNYS or in this particular kind of stage where you are, you also might be feeling that I am kind of not having the kind of capacity where I'm able to manage my people well. Okay, so this particular scenario we are just getting because of the reason we are not confident about what we are doing, right? So since we are not confident about what we are doing, it is really difficult for us to contribute well or really show that what is basically happening with our patient or how we can deal with that particular patient. So I have a few questions for all of us in this particular group. This is a kind of a poll. I'll be starting a poll now. And if you see what we try to achieve from case taking. So you can actually give one answer, choose one best answer, which is best suitable for you. The poll is already displayed. You can see a poll in front of you. This is just to understand how this particular group is thinking, why they basically what they try to achieve from seeing a patient. Okay, so I would recommend everyone to respond whatever you feel like. A case taking, what you majorly looking for in a particular patient. Okay, so we have around 145 people responded to the poll. I want every one of you to please respond to this particular poll. Okay, choose your best choice out of it, whatever you feel. I hope everyone can see the poll. Please respond to it. There are 185 people responded to the poll. So we'll be stopping this in another 10 seconds. So anyone who want to respond to the poll, please do respond. So 81% of our people have participated already. So it's your chance to respond. Please click the option which you are seeing in the screen. Okay, so let us end the poll now. And can you display the results of the poll, please? Okay, so this is what the answer we have got for this poll. I hope everyone can see the answer for that particular poll. More than 52% of people, basically, you feel that you are trying to understand the patient while we are looking at a particular patient, like by means of case taking. And around 28% want to understand the disease. 16% basically want to make a treatment plan out of the case taking. That is their look forward to that particular thing. And around 5% of people want to identify the risk in the management. Okay, so now we have a very kind of a mixed crowd over here, and I'm glad that around 50% of 50% of the participants want to understand your patient. That is the least bothered area in medical practice as of now. Nobody wants to understand the patient. You want to just give a vaccination or a drug or a hip bath or an enema and satisfy your patient. And it is more about the disease, more about your treatment plan, and not to get any risk in the management while we are doing. But understanding the patient is very important. Let us see how this particular things turn out in next slides. So when you go again, I have another one poll for you. So how naturopathy treatment decisions are made, like whenever you want to make a prescription, like any patient coming in front of you, on what basis you make the treatment decisions, like this treatment should go first, or I'm going to give this particular treatment for a particular patient. So you can see another poll which is displayed in front of you. I would invite everyone to respond to that particular poll, which you can see in your screen. How naturopathy treatment decisions are made. So we have given around 5 options. Based on the symptoms, based on the philosophical tenets, based on the patient's convenience, based on evidence from literature, or based on the laboratory findings you get, like you may get a thyroid patient with an elevated TSH level, or any kind of patients which you're getting in front of you. It's very good if you are responding to this, because we will understand the pulse, and there is no right or wrong answer over here, because it's all about your conviction while you are prescribing your treatments. Since it is a naturopathy case taking and prescription making masterclass, we would want to see the pulse of you guys. How do you basically feel about while you're making a treatment planning? Okay. So around 202 people already responded to the poll. We have another 30-40 people. Okay, I hope, I guess we can stop the poll, and can you please display the results, please? Okay, so when 87% of your participation, you can see in your screen that 37% of our people just treat, irrespective of all of us are naturopaths, except 2 or 3 from different backgrounds over here. Most of you prescribe or make the treatment decisions based on the symptoms, like whatever symptoms the patient is presenting with. And we have around 18% of the people who uses the philosophical concepts like toxemia, vitality, unity of disease, and unity of cure, which are the guiding principles for naturopathy in making your treatment prescription. And 17% based on the patient's convenience, that when you do a clinical practice in a private practice, many times you look for when you prescribe an enema, if the patient say, no, I don't want enema, you won't be prescribing, and it is mostly on patient's convenience. And around 15% of you feel like you need some kind of evidence for prescribing your treatments. And also on laboratory findings, also 13% of people. So as you see, the so-called holistic system of medicine, naturopathy is supposedly the holistic system of medicines, medicine, what we basically call it as. But most of us, 37% of us basically prescribe our treatments based on the symptoms. So this is exactly like how modern medicine prescribes their treatments for their patients. It is a symptomatic management. Okay, and only 18% of us basically believe in our philosophies while making a prescription, and 17 in convenience and the evidence from the literature for the remaining, and 13% again you see it is on laboratory findings. So how this is going to impact our clinical practice, we will discuss in our further slides. And based on this particular results, what we have got from the past 2 slides, based on what we are trying to achieve for case taking, as well as how we make our treatment plans, our entire practice looks like we have many type of practitioners within naturopathy. Okay, it is not by virtue of your degrees, it is by virtue of how you understand yoga and naturopathy per se, and you teach to your students. We have a set of naturopathy and yoga academicians who are nowhere linked to the clinical practice, who are nowhere linked to the, unfortunately, linked to the patients, most of them. Some are definitely, they are clinicians and they are the teachers as well. But most of, around 80% of our academicians are not clinicians. So they teach what they read in their textbooks, and the students learn that particular thing, what is there in that textbook. They are half convinced with what they learn. And then we have somebody called naturopathy physicians. Why I'm calling them naturopathy physicians and dividing the others from that particular group is basically naturopathy physicians are one those who understand that 18% of people who are responded to the last poll, they prescribe based on the philosophy. No matter what happens in terms of symptoms, like you all might have got COVID symptoms, naturopathy physicians does not look for whether you are getting a flu or whether you are getting a common cold or a diarrhea. They basically, please keep yourself muted, Dr. Niva Shukla. Yeah. So those physicians are the one who understand the naturopathic philosophical tenets, which is very hard to practice. And they practice in that way. Then we have yoga and naturopathy researchers. So yoga and naturopathy researchers are from another planet, including me, where we don't consult patients every day. We do research and we publish, and we expect people to follow the same. So we three are in 3 different zones. And then we have those people of all the things you learned in the entire 5.5 years or whichever year you are learning in naturopathy in your respective medical schools. You are fascinated either by nutrition, you want to become nutritionists, nutrition advisors, or you are very much fascinated about tricking people. You become acupuncturist and practice specifically acupuncture, and you become spa managers, or you become yoga consultant, specialist, or yoga charyas, whatever you want to call yourself. So this particular kind of practice is what we are seeing, this sporadic distribution of our practitioners across different streams, practicing different things, is basically because of the kind of lack of understanding about what we do. And if you see the number of naturopathy doctors available in India, if you just take a random number based on unconclusive statistical report, we are having around 7,500 yoga and naturopathy physicians across India. That is a very, very meager number. The amount of practitioners which we would be requiring for providing the care to our fellow Indians is very, very meager. We are around 131 crore population in India. And take out all the academicians, researchers, the so-called nutritionists, acupuncturists, spa manager, the yoga consultants who are not serving for the common people. And we are most catering to all the high class or upper middle class or middle class people to an extent. None of the lower class people or lower middle class people are coming to a naturopathy clinic. More 20% of or 10% could be the number you will be getting a low socioeconomic section of the society, or otherwise it is a government hospital where you are trying and treating. Otherwise, naturopathy is a very costly affair, and we are not able to convince our own parents. We are not able to convince our own spouses. We are not able to convince our own colleagues and the people around us. In the same medical college, in the same medical school, we have 10 different opinions. If I just ask about vaccination, we are around right now, we have around 250 people to be exact. If I ask about whether you are going for vaccination, if you're not going for vaccination, I can get around 250 different responses. And that is how the kind of naturopathy knowledge what we possess. And it is not a bad thing to have different types of opinion or ideologies about naturopathy. And naturopathy is because always it is very dynamic, because naturopathy is very much, it's a polarized phenomenon. Wherever you look from that side, it look like that. When you look that acupuncture is very good, it shines bright like anything. Or when you look nutrition is very good, it feels like nutrition is the most important thing which we need to follow. And yoga, no matter now, it has been magnanimous intervention thanks to the government of India, which are promoted. Everybody is doing yoga on parks, they are doing yoga in buses, they are doing yoga in tree without understanding what is yoga. Okay, so now if you move ahead with the kind of diversity in practices, when we look into our practices, what we do as naturopaths, very, very meager number of people are primary care physicians. I hope everyone understand what is a primary care physician. When a person is falling ill, if the person is first coming to you as a naturopath for his or her treatment, that means you are in the primary care practice, which is like less than 1 or 2% of our entire population, entire naturopathy physicians. We are not available in naturopathy primary care as primary care physicians. We are either therein as a rehabilitative experts. If somebody is putting a stent and coming to us, we'll be happy for doing a cardiac rehab. Or if somebody is getting a stroke, we are very happy in giving the paraplegia rehab. Or we are very much happy in managing the blood sugar levels of people, which a metformin can do in 1 rupee. Or we are a supportive therapist in a particular setting where we are just there to manage the side effects. So this is one type of perspective. And I, being one among you all, I have the right to criticize all of us because it includes me as well. Don't feel I'm just criticizing each one of you over here. It is including me. Why I am just doing this is because, like, when something is not working, it is not because of the system is not good. It is because we, the followers, the disciples of the systems, are not very really good to flourish the system how it should be. How many of us over here have practiced naturopathy for ourselves? Like, I'm sure that many of you might have been, but majority of our population does not practice it for ourselves, not in our home, not in our community. We don't even propagate because it's very difficult. I'll just show how it is going to be difficult. And another set of practice what we have is like, we always, whenever we say something, we bully the modern medical approaches. We say that, oh no, vaccine is not good. Or we say that, no, they are not doing, the antibiotics is not that very much effective. So you should use this particular natural turmeric, which is equally effective like that antibiotic which you're going to take. And it is equally going to kill the microorganisms, which it is causing that particular XY disease or syndrome. And we present ourselves as a side effect less system of medicine. And we always proud. So whenever somebody asks you, what is BNYs? Or if somebody asks you, like, what are you studying? So you will be saying that we are studying a very noble system where there is no side effects. So this is what I used to say back in some 10, 12 years back. And there are certain type of practitioners, they are practicing naturopath come whatsoever, standalone system with its own philosophical strength. They do not feel the need for looking or bullying other system. We don't have to bully other system. We don't have to say that Siddha is bad, homeopathy is bad, allopathy is bad, dentists are bad. We don't have to say that. What is good in you? Do you understand what is good in you? Do we understand what is good in us? And if we are understanding what is good in us, how we can fine tune that particular practice, what is good in us, we can well become a standalone system with its own philosophical strength. We can manage typhoid, we can manage fractures, we can manage COVID, we can manage any XY syndrome. But we need to understand what is a disease, what is a health, and in naturopathy perspective, naturopathy philosophy, whether disease are just the laboratory reports, or we should look into a person for their laboratory reports and try and treat them to that laboratory reports. This is something which we basically should understand while we are trying to look into our practice. So we have all these three kind of different perspective or different kind of combinations we have among our fellow physicians. I am also one among anything over there where I believe naturopathy as a standalone system of medicine with its own philosophical strength. I believe that because I practice it myself. Don't think that I live in caves. I live in a flat. My wife is not a naturopath, but still I have not vaccinated my kid. I don't use antibiotics. I just wait for my system to respond to things. I give the time for my system, and I teach my people also the same thing. So when you practice something for yourself, it will be very easy for you to advise that to the particular patients. For that, we need to understand why a disease per se is happening. Or is it only about the raising blood sugar level or raising blood pressure or elevated CRP levels? We are so much worried about all those things, right? So over the period of next 2 days, what we will be doing, like today we will be discussing about how to take a case report and what are the components we need to look into while we are taking a case report. And while we are going tomorrow, what we will be basically looking is like, we'll be looking into how we can look into some examples. Like for example, if you take cardiovascular system or diabetes, how we can basically treat that particular condition by rooting to the naturopathic philosophies, and what you need to basically look into while we are taking a case report, so that we can effectively manage our people with our own what to say own philosophies. And now this is something which I have taken from my last 2 years back session, the identity of a yoga and naturopathy physician. How you identify yourself. How many of you are proud yoga and naturopathy physician over here? Do you feel vulnerable? Do you feel like I'm very demotivated, or you feel like that I want to become like a modern medicine doctor, everybody is respecting him, and or like I have by mistake I have joined BNYS or whatever naturopathy courses you have done? The professional identity for you as a doctor, whether you will get respect or not. Now, like I believe why you have joined my session. So there are a lot of webinars going around. I'm not boasting of myself. Why you have joined my session? I can definitely say that at least 100, around 250 are here. At least 100 of you are convicted the way what I am saying things, or you might have been practicing it for yourself. You want more knowledge. So people will listen to you when you repeatedly speak the same thing, when you repeatedly do the same thing with conviction, with proper evidence. I am a researcher too. I don't just bluff just because I am in too much love with the system of naturopathy, nothing like that. When I am a researcher, I look into the data, I look into how things are being practiced across the country or across the globe, and how it is not right. So your professional identity, my professional identity is defined by the values and beliefs I carry as a professional. The values, when you say that germs do not cause disease, you don't have to worry even for a single second that what if the germ is more powerful than me. That is not going to happen. You need to be strongly believe, or you need to see that what we have as an infectious disease is just an association of things, of data which is put forward to you guys. Okay, so the professional identity is based on our thinking, how you think when a person is in front of you, when you have a diabetic, when you have a hypertensive, when you have an obese patient, what do you think? Like the survey which I have done just before, somebody you think about the symptoms. Please mute yourself. Please mute yourself. Okay, some of you think about the symptoms, some of you think about the philosophy, some of you think about the laboratory reports while we are trying and treating a particular patient. So what is your thought process, how you are acting based on your thought process, and how you are interacting with the patients. This particular thing define yourself as a professional. So you want to identify yourself as a mere yoga expert, or mere nutritionist, or a mere acupuncturist, or mere whatever you want to do for yourself, or you want to identify yourself as a physician. Why people don't give the kind of value to us, or you are not getting the value enough? Because you think so low of yourself, because you think so low of your system of medicine. Our system of medicine is so powerful. Unfortunately, we don't understand what is a kind of magnanimity and how our system operates. Okay, so this is basically something called symbolic interactionism. How you present yourself, what is the moral philosophy which is guiding your practice, and what is your work sociology. Work sociology means your work is not just based on what you think about yourself. Your work is based on how the person think about your work. So when you're giving fasting to some patients, you believe that fasting is very good for the patient, but patient also should be in the same page. Otherwise, the treatment is not going to work. That is why Even though you fast for 10 days, 21 days, some person do not fast, they lose their weight faster than the person who is fasting. None of the treatment works in the same way for the different patients. That is the beauty of naturopathy. And similar thing happened in modern medicine also, but we do not see the larger picture. If every person, a drug has to work in the same way. A single metformin can take care of the blood glucose level for all the people across the world, but it's not happening. People are requiring glimepiride. They are requiring an insulin subcutaneous injection. Why this is happening? Or they are requiring some additional support from a Ayush physician, an alternative setting. So this is happening because every person is unique. And we say all this, we speak about all this, but we do not practice all this. And we see that it is very difficult to practice all this. It is not difficult. It is just about changing the mindset. So why we should apply the philosophy into practice? If you see, philosophy can be a tool for improving your practice. Like whenever you are in doubt, just believe in the system of medicine, what you are. So there are many things which you learn in your philosophy of nature care during the first year of your medical college. And later you forget by the end of the 4th year because you are overwhelmed with therapy, or you are overwhelmed with the kind of knowledge you get from modern medical subjects like pharmacology, or you always envy the other person's practice. When the COVID-19 is there, you are worried that nobody is calling us for giving treatment, or you yourself don't want to take because you are worried that what if I die? And we always can you please mute Rishma? Please do not unmute yourself unless you're speaking. Please mute yourself. Okay, so we always envy others, because if you see a modern medicine doctor, we don't have to bully their practice. They're practicing their system of medicine in a proper way. They are looking for the symptoms and they are treating the persons by means of their symptoms. Okay, and what we are doing is we are also doing the same. Like 38% of us told that we prescribe treatments based on the symptoms. There is a huge gap between the philosophy and practice. What we basically do, what you learn in the first year is never applied, whether you are giving a mud therapy or you're giving a hip bath, or you want to give a enema. We are just utilizing that as a tool. Here metformin, here fenugreek juice. Here you give curcumin, here you give antibiotic. This is the combination or comparisons what we do. How we can do in the same way like they are doing. How I can make a prescription. We need to basically understand, if you want to fill the gap of that particular thing, the distance between the philosophy and practice, we need to have a proper explanation on whatever you do. Whenever you are worried about an infectious disease, you need to have a rationale if you should worry about an infectious disease. And you should criticize what you are doing. And you need to get a proper direction, and you need to have a proper imagination that what you want to achieve. So if I see myself and imagining if I'm processing in the same way with what I'm doing, I can basically help myself. Frederick, your mic is getting on again and again. Please mute yourself, please. Frederick Obo from Ghana, please mute yourself. Yeah, I'm muting her again and again, but she's unmuting us. Okay, so when you see, there should be a working philosophy for every person. And the working philosophy refers to an individual adult educator's system of belief. And we always say that when I ask you, are you a doctor? Yes, you are a doctor. What kind of doctor you are? We are more of an educator than, there is no definition for doctor per se. Doctor is somebody who can offer cure. And the kind of way we are practicing, we are not offering cure. We are offering something called a temporary relief to that particular patient. We are more of a healers or an educator, where we influence people's system of belief. There is no harm in people believing that germs cause disease. There is no harm in people believing that eating 10 grams of 10 grams of fenugreek every day is going to cure my diabetes or heal my diabetes. That system of belief is installed by the culture. So we need to understand from which place these people are coming from. What is the kind of belief system they carry? And when you apply this philosophy in practice, why I'm explaining this before we get into our case taking is because this is something which we basically require while we are going to practice. So when you apply the philosophy in practice, the explanation is something that how a particular phenomenon is happening, where, for example, if you get COVID-19, for example, okay, so you got an infection, you're getting severe malaise, you're getting kind of fever, body ache, there is a loss of smell, loss of taste, and all those stuff. So at that point of time, when you look that particular condition without a philosophy, it looks like an infectious organism came and attacked you, your immune system has gone weak, and you are getting a lot of symptoms in the body. Now we need to intervene. So this is a philosophy-less ideology for COVID-19. When you look into the same COVID-19 with the same kind of symptoms, with a kind of philosophy, at that point of time, you can see that your system is reacting to something which is untoward at that particular point of time. The system needs rest. It is a short-term adaptive response, like an inflammation which is happening in the body. What we need to do is like to support that particular thing. How we will be supporting? Not by indulging in excessive treatment, just giving the required rest for the digestive system, improving all the eliminative channels, be it your lungs, be it your gut, be it your skin, and be it your kidneys. Improving all these eliminative systems. This is what philosophy advocates you. And what we practice and what philosophy is advocating is completely different. We do not have time to look into the philosophy and look into that particular phenomenon which is happening into you. And criticism. Do not just blindly believe whatever people are telling to you, including what I am telling to you. All the theories which is given to you, if somebody is sneezing, you will get cold, or if you are continuously eating fat-rich diet, you are going to become obese, or if you are having a high LDL levels, you are going to die with a heart attack. These are theories proposed by different scientists from different part of the world. You don't have to believe in all these theories just because it is published in a reputed medical journal. You have to use your own wisdom, your own philosophy to dissect this particular thing. And if you see, one of the most controversial thing is like the LDL causes heart disease, or is a risk factor for coronary artery disease. There are at least 16 to 19 large scale studies, including Framingham Heart Study, which is one of the largest cohort study conducted till date, saying that the cholesterol hypothesis. But epidemiological studies does not suggest the same. I'll show you the papers tomorrow when we are discussing that. None of the epidemiological public health studies suggest the same. In fact, LDL, the people who are having high LDL levels are dying later than the people who are having normal LDL. Okay, so basically we need to understand. Dr. Ebenezer, please mute yourself. Yeah, thanks. So then what we need to have, the philosophy will be giving a direction to our clinical practice, how we are practicing a system of medicine. Like we need to look for the different facets of a particular disease. Okay, so when you just take a kind of a disease. A disease is not just something which is occurring just like that. Okay, a disease is something which basically look into multiple dimensions. If you take hypothyroidism, for example, hypothyroidism is not just TSH levels getting elevated, right? If you just look it into that way. So recently I am writing a case report right now where a TSH level is normal, everything is normal. She just cannot tolerate the levothyroxine which is given for this thyroid patient. So it is not just the TSH levels, it is not just the obesity, or it is not just the hormonal imbalance. It is from the thought process where the particular patient is in. If TSH is the only problem, by giving thyroxine 75 mg, 125 mg, 25 mg every day, you can bring back the TSH levels normal, and the patient should be recovering. The patient should not get any kind of infertility. The patient should not get any kind of psychological symptoms, but we can never see a single patient like that. Hypothyroidism is a very dynamic case, like most of you might have experienced. Many of you might have for yourself as well. So we need to have a proper imagination to expand the limits. So there is a textbook of mine. Most of you might have read The Scientific Naturopath, and the second last chapter in that particular textbook is about medical miracles. When you can create medical miracles, when you believe that something is going to achieve by properly following the body signals. How many of us are ready to treat a cancer patient here? Very less than 10% of you might be. How many of you might be ready to just treat a patient who are posted for, let us say, this CABG, that bypass surgery? You want to treat that particular patient without a CABG? Very less number of us, because we are not confident, that we are very scared about the medical reports. We are very scared about the laboratory reports which suggest that this is going to be harmful. We have a patient whose creatinine level is around 11.5. He just don't want to go for dialysis. He came to us, the patient's willpower, the vitality was very high. And vitality is not linked to a disease. Vitality is independent of a disease. You should understand that. I'll explain that. So his creatinine level is 10.5. He's taking treatments with proper counseling, proper diet, and things like that in our hospital. If you're not scared about that particular report, it is easy for you to manage any particular condition. That is the kind of imagination you will be able to achieve by means of proper philosophical support. And many a times you will be seeing the degree holders versus non-degree holders in naturopathy. Okay, so there are people who are institutionally qualified, who went to medical schools, have a bachelor degree, and the people who have just experienced naturopaths or health promoters or whatever they want to call them as. Those people have more confidence or blind belief on what they do. That is just because of the reason they are not becoming a machine by just reading medical textbooks. We are so much worried about the so-called normals, abnormal values, risk factors. There is nothing called risk factors which is common for you and me. If you say that smoking is a risk factor, every person who smokes should die. But it will not happen in that way. It depends upon multiple components or dimensions present in the same patient, whether you should die of a heart attack or whether you should die of a disease, which is the risk factor is so and so. So we need to basically apply this philosophy while we are practicing. So when you see naturopathy philosophy and principles while we want to treat a particular patient, the patient-centered approach is something what we require more. It is not about what you know as a naturopath. You may be knowing hundreds and thousands of things about a particular disease based on your medical knowledge, and you know a lot about naturopathy, but it is not at all about that. If it is like always about what you know, the patient is going to recover in naturopathy. But our approach is completely wrong. We are more of a symptomatic reductionist physician. If a diabetes patient is coming, we will be giving a hip bath, we'll be giving a pack, we'll be giving some exorbitant diet, and all those things we'll be giving to our patients. And we expect these treatments to work in that particular patient. And we don't worry about what is the state of affair for that particular patient. What is his vitality? How many of us understand what is vitality? Vitality is not how you are. Vitality is about, even with a disease, how you are able to cope about a particular thing. So when you want to achieve symptomatic relief, whatever we are doing is right. Give packs, give diet, or give whatever you want to. But if you want to have healing, healing requires patient-centric approach. And this approach is not just on the current accepted mode of health practices. And I've seen many of my fellow colleagues posting on their Instagram and Facebooks. You put a stethoscope around your neck and you'll be posing like this, like me, how I post for my masterclass program, and I've just posted across your personal walls, right? Why we use that stethoscope? When we say that we use for heart, finding the heart sounds, heart rate, and things like that, how many of us really do that in our clinical practice? I've seen many of the people who passed their final year immediately in the internship, immediately they took a photo, become doctor, congratulations, thank you, mommy, thank you, daddy. So we look that as a symbol of discrimination between you and the patient. And we all are aware about white coat hypertension. For just one example, how your status quo can scare the patient. If you wear a white coat, that is going to increase the blood pressure by 1 or 2 millimeters of mercury. This particular patient-centric approach is more underpinned with the naturopathy philosophy and principles. So I would recommend everyone to go through this particular book, which is given this particular chapter, Naturopathy Case Taking, an evidence-based clinical naturopathy textbook, and not mine, this Jerome Saris textbook, where they have beautifully explained how the philosophy is going to guide this patient-centered approach while we are approaching a patient. And our consultation is going to be a patient-centered approach. I always remember when I passed out in 2010, I joined National Institute of Naturopathy, where Dr. Babu Joseph was the director of National Institute of Naturopathy by then. So we were all relatively very young physicians. We just joined NIM. So he was the only person with that many years of experience. And he always tell us that the first consultation of naturopathy should be minimum 45 minutes to 1 hour. And we as a very modern naturopath who are looking for which therapy to apply for which condition and how to diagnose that particular thing, we were kind of very much aggressive about our practice, and we do not know what to discuss with the patients for 45 minutes to 1 hour. Dr. Amrin, the book's name is Clinical Naturopathy and Evidence-Based. It is there in the footnote. You can see the book which I have just referred to. It is there given as the reference, and this PowerPoints will be shared with you all. Don't worry. So when I just look into this particular phenomenon, what I will be discussing with my patient for 45 minutes to 1 hour, what I will discuss. Whatever I learned in 5.5 years will be finishing in 15 minutes. I don't have anything. All my stethoscope, BP apparatus, and all pallor, rectus, nil. S1, S2 heard, thorax is there, trachea is there in place, abdominal examination done. All these things, NAD, provisional diagnosis, whatever is in the laboratory report, you write. And we name and label that particular patient as you are a hyperthyroid patient, you are a hypertensive patient, you are a cancer patient, and they lose their name. You are no more Pradeep, you are no more Amrin, you are no more that particular person who are you used to be, right? So we are so much away from this philosophy, so we won't be able to discuss 40 minutes with our patient. The patient want to speak a lot because whenever they see a naturopathy doctor after a long time on whatever they are practicing, they are seeing a doctor after a long time who speaks for more than 5 minutes to them. Even you might have encountered modern medical consultations where people speak for 5 minutes or less than 5 minutes. Your consultation is over, your prescription is done. So we have something called decision management systems now in modern medical practice, where in a single click with your diagnosis, all the follow-up it is printed out. In all NABH hospitals, that is followed. But when you as a doctor speak for more than 5 minutes or more to 15 minutes, the people are very fascinated. The patients, they want to discuss a lot of things with you. But we often find it very annoying because we do not understand the importance of letting the people express themselves, and we have to understand what is the root cause of that particular disease. The root cause of diabetes is not insulin resistance. The root cause of hypertension is not your impaired renin-angiotensin mechanism. The root cause is something which is very specific to that particular person, which is what Louis Kuhn has called as unity of disease and unity of cure. That is the root cause which we need to try and understand and try and kind of treat when we take a patient. So I'll give a break in another 8 minutes and then we will join again back after 5 to 10 minutes. Okay. So let me finish a couple of slides more and I'll give you a break. Okay. So now let us get into the business. So why this philosophy is needed in consultation? You always think that I don't need philosophy in consultation. If I'm very good in your Harrison's maculates, I can diagnose the patient. I know very much where to prick with acupuncture, what kind of diet to prescribe, what kind of nutraceuticals to prescribe. I all know all these things. Why we need consultation in a philosophy in a consultation? What I'm going to do, lowered vitality, toxemia, unity of disease, unity of cure, what I'll do with all these kind of concepts in my consultation. The philosophy is very, very important in your consultation to get a clearer understanding on what constitutes good health. If I ask any one of you what is good health, what is health, what we will say? We will be saying that all the recorded voice, right? Like health is a state of being, physical, mental, social, and spiritual planes of being, and not merely the absence of disease or infirmity, according to WHO 1949. But do we practice all this? We are just practicing health is a state of being completely healthy in the physical or to an extent mental, because we are yoga and naturopathy physicians. We don't worry about social health. We don't worry about their spiritual health altogether. Okay. Okay. Thank you, Prasanna. So if you see, and then we always want to know how illness is caused. how illness is caused. We will be concluding immediately how COVID-19 is caused. Can you just type in your chat box how COVID-19, what you feel, why COVID-19 has come to earth? What do you think about COVID-19? What is the cause of COVID-19? Can I see some response, single word response? I don't want paragraphs. Just one point answer, why COVID-19? Because it's a very relevant topic. Can anyone please give some answers? Okay, so I'm getting a couple of answers. One is ecological imbalance. Dr. Gurudat sir, Dr. Bashira saying lowered immune system, lowered vitality, okay, unhealthy lifestyle, lack of prevention, lower immunity, altered resistance of the body, lack of immunity, breaking natural laws, flu, immunity, fear, lower immunity, natural healing process, stress, going in reverse order of nature, fear, poor immunity with too much stuff, imbalance, unhealthy fear, lower immunity, again flu, lower immunity. Okay, so this is exactly why we are reductionist. I would say illness is caused by all these things, and there is no single thing which is responsible for a single thing which is happening. I'm still getting against the nature, fear of overthinking, so many things like reduced because of natural herd immunity. Immunity is something very what's a dynamic from our childhood. So I would say COVID has happened even because if you are a C-section delivered kid, it is because of a C-section. Or I may say your mother has not fed you enough milk during the weaning period. That could be also a reason. You are not exposed, you are not allowed to play in the atmosphere, play in open the air. That is also could be a reason. It can be also due to the antibiotics which are taken. And what we are blaming altogether, SARS-CoV-2 virus, right? And I am very happy none of you told that as an answer. So to an extent, we are a very happy and healthy community. We are not blaming the infectious organism, at least here. So it is a combination of everything where this organism has came and it has got all the blames. So why illness is caused can be only analyzed if you have philosophy in your brain. If you do not have philosophy in your brain, you will be also using all this sanitizer in your hand. You will be also using everything, whatever is being advocated without any rationale. And what is the role of practitioner? Sometimes we think so high of ourselves, like we think that we are the one who is running the life of that particular patient. If at all we are not there, what will happen to that particular patient? We do not understand what is our real role. And many a times we do not understand what type of treatments we should give to our people. We just give whatever we have or whatever we believe that it is going to work. I'm saying like whatever I'm discussing over here is like I am trying to make a kind of an impact in our community where we get the chunk of the practice what we should have, and we should focus and move forward in the same way together, looking things in the similar way together, where when we look together with the same kind of concept, same kind of philosophy. I'm again saying not the patients are going to be different. Whatever way you look, every patient is different. But the ideology with which you look your patient is going to change when you are having this philosophy in your consultation. Okay, so we will take a break now. I think it is 1 hour since we started. I'll stop sharing now. I'll take a break now, quick break. Maybe we will meet back by 8:05. Okay, so we'll take a 8 minutes break. I would request everyone to come back by 8:05. Okay, let's continue from where we stopped. Okay. So we were discussing why it is important to have the philosophy in the consultations. Okay, so as we move ahead, we need to know a little more about a bit of philosophies because around half of the participants are new participants. I'll just add a few more words about. So the entire clinical practice, where you just look into prescription making practices. Please mute yourself again, Frederick. I'll mute everyone. Just keep a minute. So if you see the entire clinical practice of naturopathy, basically it depends upon how the unity of disease and unity of cure is being understood by you as a naturopathic physician. So this is very simple thing which is given, which is seldom understood by most of the naturopathy physicians. Even in the colleges, it is not taught in the way it should have been taught. So we just don't understand what is unity of disease and unity of cure, and we just practice it based on whatever we understood. And I don't even know that how many of us basically utilize this particular kind of information in our clinical practice. So Louis Cunet basically, and many a times I have seen even in Vivas when we sit in colleges, people, when we ask what is unity of disease and unity of cure, people will be saying that unity of disease and unity of cure means you are basically treating the same cause with the same kind of treatments. So this is what people basically say if we ask what is unity of disease and unity of cure. But is it that what unity of disease and unity of cure is all about? It is not that in the same way. Unity of disease and unity of cure is something which is given for us to understand the root cause of a particular disease. What is the root cause of a particular disease? If you move ahead and see, for every kind of disease or every kind of person who is coming in front of you with any
rules on phone on Hindi
So unity of disease and unity of cure is basically a 4-layered approach whenever you want to find. So unity of disease and unity of cure, when we basically look, it's basically a 4-layered approach what we want to look into a particular person. Okay, so this explanation can be seen in my textbook also. So whenever a person is coming to you, so he's coming with the first outermost layer, what we call as disease. They will be coming and identifying themselves as, doctor, I have XY disease. So immediately what you will do as a physician, because we are so dominated, yes, Dr. Viral, I have actually done the muting, and I wanted to comment on something from the comment box later on. Somebody has told about ignorance towards being healthy. Yeah, it is the ignorance towards being healthy as well. But you basically see when a person is coming to you with a particular disease, so they don't come to you by saying that I have some XY individual problem for myself. So they'll be coming to you with saying that I am a diabetic person from 15 years. I am taking treatment from this particular doctor. I'm taking all these medications, and I have also consulted a homeopath. I've also consulted an Ayurvedic physician, and these are the drugs which I'm taking. And my blood sugar is not coming down, and my knees are aching. I have got many problems over the years. Now I want to get a kind of a cure from naturopathy. So this is how a patient present to you. So you are very excited. We got a patient. Immediate thing, what is the next thing you do whenever you get a patient like that? We will be immediately going and looking for his physiological factors. What is his blood sugar levels? What is his blood pressure? What is his going to be his CRP levels? What is his inflammatory markers? What is his HbA1c? And when we look into all this, we now know that now the medicines is not working. You do these treatments. This is going to be helpful for you to reduce the so-called symptoms of our disease, or the so-called physiological elevation of a particular disease. And this is a level of treatment which we all do irrespective of what we practice. But is it what is called root cause of disease? If this is the root cause of disease, by now, all the naturopaths in this particular group and all of our seniors who have been practicing for 20, 30 years, they might be world famous. But why we are not getting into that kind of space? Why we are not able to create that kind of impact to our people? Because we don't use our system in depth. We don't reach till the root of a particular condition. Besides the physiological factors, we go and correct something called environmental factors. That is your diet, that is your circadian rhythm, that is something you ask them to do exercise, yoga, have organic food, or whatever they are not doing in terms of what we call the so-called the lifestyle. Even after correcting the lifestyle, we can take a lot of examples. Many of you are from Karnataka or South India. Puneet Rajkumar, if you take, or the guy those who from North India, Siddharth Shukla, who won the Big Boss. Do you think that their lifestyle is very bad? They may be having 1 or 2 packs of alcohol, but they do work out really hard. They all had 6 packs for themselves, very muscular, no extra fat deposition in the body. They can afford organic food. They can afford very good doctors, the so-called doctors in the world, but still they died very early, irrespective of having everything, irrespective of correcting all the possible environmental factors. They might have probably the first one to get the vaccination too. Probably not the Covaxin or Covishield what you have taken. It may be the Pfizer one, which is imported from US. It's very costly, or the Sputnik from Russia. Irrespective of correcting the environmental factors, why people are dying, why people are not able to control the so-called disease, which is a transient state of mind. It is because of the individual factor which is present in each and every patient. And this individual factor can be elicited only by doing a proper consultation. Imagine if I fight with my wife, okay, and I'm fighting for maybe 5 years continuously. I'm fighting, and or individually in my mind, I'm not happy with my wife. Like she's always dominant and she's doing a lot of control over what I do. I'm not able to go out, socialize, or I'm not able to spend my money, or I'm not able to do whatever I want to do because you're married. If that is the condition which is in your home for 5-6 years, and over a period of time, my environmental factors are also affected, or I am doing good environmental factor. I look fit. I just do exercise. I have good diet. I practice everything. I'm a very hardcore naturopath, but I'm fighting with my wife. Or even I'm not fighting, I'm suppressing. I want to become very dominant. I have to say that you don't say like this to me. But I'm not saying that because I don't want to maintain the peace at home. If that is a scenario which we have in our hand, I got a diabetes. And you are telling that you should exercise. I'm exercising already. You should follow a regular balanced diet. I say I'm following it already. You should do yoga. I say I do 1.5 hours of yoga every day. You should eat organic food. I'm eating organic food. You should sleep on time and wake up on proper time. I'm saying I'm doing that already. So now what is the answer for you? What do you have in your bucket to say that I am having an unhealthy lifestyle? And I do not myself acknowledge I got this diabetes because of my issues at home, and because I do not consider that as a reason for my disease. Or you are continuously thinking about a particular condition, or you are, and I have recently read about musculoskeletal disorders. Musculoskeletal disorders prognosis is worsening because of feeling of injustice. That is a biopsychosocial aspect of the particular disease. So that is what is called the individual factor in each disease. For each person, the individual factor will be different. It is not that suddenly we got inflammation or suddenly our insulin started resisting and not accepting glucose. It is happening over a period of time. And we need to find the trigger, which can be a simple change in place. So I have seen like patients who will be coming to us and saying that, sir, I got a knee pain. So I'll ask them, why suddenly you got a knee pain? So they say me like, I have sudden, my work has been shifted. I was working in Pune. Now I've been shifted to somewhere near Solapur in a small village where I don't have any kind of toilet facilities, or I'm in a metro city and suddenly shifting back to a kind of a village is kind of adaptability issues. And this is what changed in my life. Otherwise, like I'm doing everything really well. So the acceptability. So she's thinking that there is some injustice happened to her or him by getting transferred from Pune to Solapur in a rural district. And in our textbook, this is not written as a risk factor for a disease. In our textbook, it is not written that this can create flight or fight mechanisms which is responsible for inflammation. This is where exactly everything starts. This is called meta-inflammation. Irrespective of you have hundreds of nutraceuticals, irrespective of you have the best doctors treating you in the leading naturopathy or modern medical hospital, people are not going to get cured because the individual factor or the root cause of a particular disease is not addressed properly. And this is where a naturopathy consultation become very, very vital. It is not about the enema or the fasting or the acupuncture or the yoga or whatever treatments you're giving. It is about on what state of mind or what state of root cause is triggering this particular condition. A disease is not just triggered by an organism. A disease is not just triggered by nutrition. A disease is not just triggered by the environment. A disease is not just triggered by the biochemical parameters within the body. These are just reductionist understanding about a particular disease. If at all you want to see the complex part of a disease, it is really difficult for treating the complex part of a disease. So it is easy for us to say, yes, blood glucose, yes, blood sugar, HbA1c, or CRP, or twist in your spine. This is very easy because it is very physical, which is available in front of your hand, and you can show some visible change. But if you ask a person not to shout, don't be angry, don't think ill about others, it is very difficult. And this is where the starting point of what we call as yamas and niyamas in yoga. And if you cannot achieve that particular kind of thing based on what you're doing with your therapies is not going to work. To put it more scientifically, we all are very scientifically oriented people, and we all know there is something called brain waves in our brain, which responds to different state of mind. Now we are interacting with each other on a virtual mode. You may be probably in a kind of an alert state. I hope all of you are in alert state. Or you may be in a drowsy state. This person is eating my brain for past one hour. Or you may be in a state of like very super conscious. So you have alpha, beta, delta, and theta waves. The kind of waves which is being dominant in your brain while you are undergoing a treatment. So let us say if you are in a state of a complete relaxation, or you are kind of a very refreshed state, usually your alpha and beta waves are very dominant here and there. So in meditation, you get into a drowsy like state, or you get into a super conscious state. If you are not in that state of mind, or if there is no alpha waves being dominant in your brain, where you are relaxed in a very relaxed manner, whatever treatment you are taking is not going to work. That is why most of our people, if you enroll in a weight loss program, they reduce the weight drastically in 10 days. They go back and they come back with the same weight. It's not because they started eating more chapati. They are following everything what you said, or they were partially following up to 50%, but they are coming back to the same position because of that. Or they may feel good within the environment of your hospital, where they feel that everything is taken care of and there is no stress. The moment they go back to their home, they are back to the same battlefield, and they are getting all these diseases back to their body because the root cause still persists. So it is not the system of medicine which has failed them. The doctors belonging to that particular system do not understand what to address and how to address that particular phenomenon. And you cannot just make a person stress-free just by saying that don't take the stress. This is okay. You cannot make. You make to go through make the person go through the process of yoga, go through the process of naturopathy, and make the person independent of your therapies. You don't make yourself the person dependent on you as a doctor. What we require is freedom from doctors and disease. And how we can achieve is by identifying the individual factor, which is a root cause for any XY disease which we are trying to treat. So what are the primary checkpoints in case taking when we look into? And I don't know how many of us take this. Many of us may be taking this. The historical precursors of naturopathy emphasize the responsibility of the patient in following a healthy lifestyle with a balance of work. Okay, how their work culture is like. We just fill the occupation column, and we do not understand till now why we are filling that occupation column. And we assume that IT people, lot of stress, kind of a person who is a businessman, a little stress, but not like IT people. These are our assumptions. We do not exactly know what it is to be an IT person or what it is to be a business person. And when a housewife comes to us, we just say that, okay, she's not working. She don't have any kind of stress that a working person might be having. What a kind of misconception. In occupation, when it's a homemaker, we don't even think that she might be having some stress, because homemaker is not considered as an occupation because you are not getting a pay slip for being a homemaker. But that is the most stressful thing to be in the world. And we do not ask what is the recreation phenomenon. When is the last time you took a vacation, or what you have done for the vacation, and what is the factors which forced you to take that vacation? Do you meditate? How you take rest? What is the kind of rest? So I'll read a book, I'll watch Netflix. That is what is called rest. And what you are eating. And eating means there are 3 types of eating. There are emotional eating, overeating, cognitive eating. What is the kind of eating they are having? How much fresh air that person is getting? How much water and sunshine they're exposed to? What are their regular detoxifying and cleansing? When we say detoxifying and cleansing, don't just jump into only enema or Sutra Neti, Jal Neti, Vaman Dauti, nothing like that. Mental emptying, what they are doing for detoxifying the brain, kleshas, the kind of smritis, how we are going to remove the smritis. All we learned in yoga, all we learned in naturopathy philosophies is to apply. We were very scared about those sutras, but it is all about controlling the yoga chitta vrittis, the modifications of mind, how we are modifying our mental reactions to a given situation, and how we are overcoming the kleshas, how we are overcoming the manasmritis, and how we can apply. That is why yoga and naturopathy is clubbed together, not just because nobody is taking yoga. And no, whoever is taking yoga for themselves today do not understand what is yoga. And we so-called the yoga naturopathy physicians, we should at least understand what is yoga. And what are the healthy emotions within a healthy relationships? It is not that all smiling couples are happy couples, or not all the fighting couples are very disappointed couples. What is their perception about leading an ethical life? And what is their concept about living in a healthy environment? None of this is related to the textbook knowledge, what we have about taking case reports. And those textbook knowledge is not going to come to help if we are using those textbook knowledge just as a precursor for taking the treatment, taking the cases and make a prescription based on that. We are never going to reach till the individual factor. We will be struck either at the physiological level or at the environmental level. And we are not going to give the so-called treating the root cause of the disease, where we all proudly wrote on our first year, or many of you are in first years, you might be already writing treating the root cause of the disease. You should understand what is the root cause of the disease. The root cause of the disease is the individual phenomenon existing in each person, which is different for each diabetics, which is different for each hypertensive, which is different for each healthy individuals as well. Moving forward, what comprises of a naturopathic consultation? All these views which I have just explained highlight the fact that each patient is unique. So whenever the patient is unique, how can we treat each patient with the same kind of treatment? So here the treatment is not your hip baths or your enema or your packs or whatever we are giving. Treatment is even talking to your patient, clearing their mental debris from the brain. That is also toxemia. Toxemia is not you are finding in your veins, in your heart. It can be even in your mind. And how to make that tailor-made interventions. Interventions means intervening the patient's suffering, finding the root cause and treating, along with the supportive treatment. I'm not saying that you should not be giving the treatments, you close all the treatment sections. It's not like that. The treatment's prescription should be based on the person's individual factor, addressing the major eliminative channels, which we'll be discussing tomorrow, how we are going to prescribe a treatment. So an essential holistic consultation is the education of the patient to promote healthy living, self-care, preventive medicine, the unique factors that affect their vitality. Vitality can be affected by anything and everything. So yesterday I had a very aching headache. The reason was my Zoom's 500 people's subscription was not happening. I've tried 7 to 8 credit cards. It was not happening. I have only a license of 100. So I have taken money from you all guys. I want to conduct this program today. Already the one batch has been shifted to this batch. So I was really worried, and it got corrected by 10 o'clock in the evening and the late night. So the root cause is not that my Zoom was not working. The root cause was I'm not composed enough to handle that kind of situation. If at all I'm not taking that kind of pressure, and I can think about alternatives, I can just ask all of you an apology mail and say that this is not working, and it can happen. But because I am a very type A kind of person, which look for perfection in everything which is happening around me, that is a kind of very bad thing for me. So if at all somebody wants to treat me, it is not a hot food bath or a pressure on my head or putting some acupuncture needles on my head, maybe working for that particular point of time, but my root cause is not addressed. My root cause is being neurotic, being so aggressive about something which is not going to create that kind of impact. What will happen if we cancel our session today? Some of you might be feeling bad that this person is telling this every day. Many of you may understand also there is technical glitches which can happen. And it is not a very embarrassing movement, but I felt that it could be embarrassing if I cannot conduct this session today. So that is something which is individualistic for my particular condition. I need to be treated for that particular condition. That can happen over a period of consultation, the way you think and the way you make your patient understand what is that happening to that particular patient. So this is the root cause. So before we starting the consultation, we should always remember the healing power of nature. You are an educator, you are a healer, and your treatments are not meant to cure the patient. It is going to offer a healing environment. Your fasting is not going to promote healing, promote cure. It is going to promote healing. It is going to provide an environment for healing. The fasting is not going to kill the bacterium. It is going to deny the bacterium an environment to thrive more than the amount which is required, because we require bacterium as well. Identify and treat the root cause. And what is the root cause? Now you might have understood. First, do no harm. Do no harm in the sense, I always say that taking naturopathy treatment is very, very costly. I have wrote this in my textbook also. A metformin for a month is only 2,000 rupees, not even 2,000. It is, you are taking 2 doses, 600 rupees, 1 rupee is the metformin, and you get a blood sugar level lower. The same thing for a 10 days in a naturopathy hospital, you need to spend at least 20,000 rupees, 10 days, you have to take absence from your work. That is going to be very, very costly affair. So you're doing a harm to that particular patient by wasting that 10 days, not utilizing that 10 days to change that particular person, to identify the root cause of that particular disease and make the person self-empowered, having a very high vitality, irrespective of his disease status. You're losing a chance. Doctor as a teacher, treat the whole person and prevention. So this is something which we need to emphasize, or we need to remember while we are going and approaching a person for treatment. Okay, so we move ahead. The models of medical thought, what we have. The models of medical thought is very, very important while we are making a treatment or while we are consulting a patient, because I am sitting in front of you, I'm going to consult you. So I am agreeing, if I am agreeing to whatever you say, sir, my PSA antigen has gone up, I have a prostatic cancer, benign prostatic hypertrophy is there, will I die? Or I am getting an abdominal pain, do I have to go for a colonoscopy? If my thought is in a modern medical way, there is nothing called modern medical way. If it is in a reductionist way, the mainstream medicine, including naturopathy, the modern medical naturopathy practitioners are there among us who looks for costly things, is based upon a simple, elegant, implicit model. It is a very small model. Naturopathy is a very complex model. Whoever has a prefix in front of your name as doctor after a BNYS, don't think that BNYS or naturopathy is very simple to handle. We are not able to handle the magnanimity of the holism, the whole system approach. That's why we are adapting this mainstream medicine elegant model, the diagnosis and the treatment of the disease. The disease over. The doctor is expected to determine the nature and name the disease process. Cancer stage 1, cancer stage 2, cancer stage 3. When it is cancer stage 3 or 4, it is incurable. And if some person is recovering from cancer stage 4 and come back to normal, they take the credit. It's a medical miracle, but my treatment worked. If some person is dying, the treatment does not take the blame. It is a person is going to take the blame. Like he has to die. Then applies various tools with the conventional medical science, including your own therapies. I'm not conventional means not modern allopathy. Conventional means anything, anyone or anything with a reductionist approach. You identify the nature of a disease, make a process of that particular disease and apply some tools to eliminate that particular disease. Can we eliminate a disease? We cannot eliminate a disease at any point of time. And if you see, this particular modern medical thought basically has 3 assumptions. One is the disease and the health. And the patient. These are 2 separate entities. You are there as a person. I am Pradeep. I have a cancer in my lungs, a CA of lungs. Myself and my CA of lungs does not have any connection. They are 2 independent entities. That is why you are putting radiation, chemotherapy, targeted drugs all on my lungs. and my hair falls, my immunity compromises, I am not feeling appetite, I'm not able to defecate, my autoimmunity is increasing, my antioxidants levels are going down, that doesn't matter, because your disease, sea of lungs, and you are two different entities. And we can identify these two entities. That is why we are diagnosing a patient as a separate entity, and we are forgetting about that particular patient. And these entities can be treated and eliminated. The doctor identifies the disease, then does the battle with the fighting cancer. We call it as fighting cancer, or we call it as fighting hypertension, fighting myocardial infarction. And where is this particular battle taking place? On the patient's body. And what are the tools for this battle? Pharmaceuticals, prescriptive drugs, surgery, hip bath, spinal bath, enema, fasting, raw diet, whatever you want to call for yourself. This is what is happening with modern medical thought process in our treatment. We do not have philosophy. We are just therapists. Do you think you need 5.5? So people ask many a times, what you learn in 5.5 years? This is what we should learn in 5.5 years, connecting the dots from PNC to physiology, to your pathology, to your modern medicine, to your therapeutics, and how applying all these things together. Why we learn psychology? To understand the individual factor of a particular person. We are not here to provide a battlefield and treating the patient's body as a battlefield with our interventions we have in our hand. Our approaches has to change. If you do not have a philosophy why you are pricking in a particular place, if you do, there are many types of acupuncture practitioners, like Dr. Gurudat, who is a part of this program, is a very senior acupuncture practitioner who does use naturopathy as well. He doesn't practice as modern acupuncture. He practices traditional Chinese medicine. Again, it is a very vast, magnanimous practice like naturopathy. You cannot prick someone just by thinking that this is Hegu, analgesic point, prick it. It is not done in that way. That is what we have learned in our colleges. It is done in a different fashion. There is a different kind of philosophy behind that particular thing. And we do not use that philosophy. Do you think that to prescribe a hip bath just without thinking anything, just to think that it increases the blood pressure or vasoconstriction, vasodilatation, all these things which have written in our hydrotherapy exams, do you need a 5.5 year time to spend? We don't want anybody. That is why you are competition to a 6 month, 3 months, 2 months, 1 month diploma holder, because they are also in the same level. You are not understanding, they understand the philosophy better because they are not biased by the textbook knowledge what we have. Now, moving forward, I am blaming, including me. I am a senior and junior to many. I am taking the responsibility of this, but let us start the change. What is a naturopathic model? The naturopathic model of healing is a general model. It is not a unique, specific, elegant model. We do not have elegance in what we approach. Describing the fundamental process of disturbance and recovery in the living body. If any one of you have not got any kind of disease, any kind of acute disease till date, there is something wrong with your body. If you're not getting a common cold or a fever or a small sore in your body, that means your immune system is actually kind of not well. There is constant disturbances which happens in the body. There are constant recovery which is also happening in our body. We should understand this is a process. You falling ill, recovering, it's a process, and it is not a separate entity altogether. It's a method that proposes that body restores itself after a sufficient amount of disturbances accumulating in the system. So that is why when you say obesity, what we will do, we ask them to do exercise, have good diet, and don't take junk food. What is going to happen to that patient? Nothing is going to happen. Because toxemia is there in their lungs, toxemia is there in their gut, toxemia is there in the skin, toxemia is there in their kidney, the 4 major eliminative organs. We need to restore the disturbance in this particular systems, 4 eliminative channels, restore the toxemia in this 4 eliminative channels, and bring back a normalcy in that particular person. The normalcy is not so-called your normal blood sugar, blood pressure, normal cholesterol. I don't buy that concept. Normalcy is the person is coping with that particular condition really well and is prepared to cope with that particular condition really well forward as well. Okay, so this is why we call there is no cure for common cold, because the common cold itself is a cure. Every acute disease is a cure. So we as a physician, we should discriminate between this healing crisis and disease crisis, and we need to understand when to intervene, how a person is repeatedly getting allergy, why a person is repeatedly getting elevated blood sugar level, why there is a pain in a person's body. It is not just inflammation. It is not just the markers in the body. If life is that easy, we would have been showing miracle every day. Why we are not able to save the cancer patients? Because the approach is wrong. We are again and again trying with the same kind of approach, which is failed. It's a failed model which we are trying again and again. And what I'm speaking all is science. All these are published literature. So you don't have to worry anymore that whatever we speak is not science. We are definitely speaking science, but we are speaking it very low or less number of people are speaking. If you see the chronic illness, all the so-called chronic illness which the world is fighting, if the factors, so inflammation is a short-term adaptive response. If the factors continue to pursue for a longer time, the disturbing factors, it will be a systemic burden to the whole body. So cancer of your stomach or your colon is not just the cancer of your colon, it's the cancer of the whole body. Your digestive process is impaired, your immune system is impaired, your nerve conduction is impaired, there is a dysbiosis in your gut. All these things are happening. This is why you are a hypertrophy or a hyperplasia. And the reactive potential of the body to any kind of condition. Say, do you think I don't have any cancer or I don't have any blocks in my coronary artery? I do have cancers in my body. I do have blocks in my coronary arteries. I do have glaucoma formation in my eyes. I do have adiposity deposition. I do have acanthosis nigricans, which may or may not there. If our body's reactive potential is blocked by means of drug, excess nutrition, excess thought, excess drugs, we are fatigued. Our nerve conduction is fatigued. Our body is not able to eliminate. It is not going to remove the disturbances. There is where vitality becomes insufficient. So vitality is not proportional to your disease. We say lowered vitality induced disease, but it is not always the vitality which is going to cause the disease. The vitality can be improved even if you have cancer. The vitality can be very high even if you have hypertension. So now there is no diagnosed disease because I am not screened. My vitality is very, very high. Even if I'm diagnosed with a disease, it's still my vitality is high, I can recover really well. That is why there is no visible symptoms. And your iris diagnosis is a predictor for what is the kind of state, inflammation stage your body is going through. Your iris is not going to give diagnosis for hypertension, diagnosis for uterine fibroids. It's not going to give that. Iris is going to give a symptom. It's going to give a symbol that there is a weak stuff here. There is a weak stuff there. You need to identify that to find that. So this is what the vitality is all about. And this is how chronic illness basically happens in our body. So we as naturopathy students, we learn pathology, like the same intensity, the same depth, like any modern medical standards, and also its concomitant diagnosis. Learning that is not a harm, but we should apply that information in different context. In standard medicine, if you see, the pathology and diagnosis is the basis for discernment of the disease, because disease is a separate entity, it's a separate thing which afflicts the patients, and the diagnosis and the pathology you are taking just to clean that disease from the body. Whereas in naturopathy, you look the disease more as a process than as a mere entity. It is a process. When you have cancer, when you have diabetes, when you have chronic pain, it is a process which the patient is going through. It is not about the disease or the name of the disease or the markers of the disease. It is about the patient. What is that inducing that excess inflammation in that particular patient? Your thought can induce inflammation. Your food can induce inflammation. Your unhappy gut microbes can create an inflammation. So what is that triggering all this? So we cannot just look into one factor at a time and try and treat that. We need to look into everything together. We need to look into everything, your social, your moral, your psychological aspects together to find what is happening in your body. So the fundamental belief of naturopathy is that ill health begins with a loss of vitality, right? This is what we believe. Health is positive vitality and not just absence of medical findings of disease. Always remember this, published in this particular book, which is Health is a positive state of vitality and is not an absence of disease. That means with a high vitality stage also disease can exist, but disease is not going to harm you. Disease is a disturbance, which is a transient disturbance which is happening in that person's body. By raising the vitality in terms of your yoga, in terms of your treatments, in terms of your counseling, the doctor as a teacher, we can initiate the regenerative capacity of self-healing. And all our treatments are basically prescribed to induce that regenerative capacity of self-healing. Okay, so I haven't really started what I want to start. Can we stop today and continue the remaining tomorrow? Or if you are having good energy and good vitality, I am ready to go ahead. We have, I guess, around 10 more slides more. What do you want? Okay means yes or no. Do you want to continue or do you want to stop for the day? I don't want to affect your vitality. Okay. Okay. Okay, fine. So if it is good, we'll go ahead. So I'll go with the majority. I can see a couple of stops also in between. So I'll go with the majority. There is no force in saying that, okay? You can ask to stop as well. Okay, so since the majority of votes came for continue, I'll just continue for some more time. Okay, maybe another 15 minutes, we'll wind up. Fine. Okay, no more votes. Thank you. Okay, so vitality is something, means positive health, or positive vitality is called as health. And it is not the absence of medical findings of disease. You still find the medical findings of disease, but the vitality is really high, and that's not going to happen. Many times it's like our information which is fed in our brain is making us so dumb, and we are aggressively approaching a total cholesterol 250, 300. We are worried because the knowledge, and the knowledge is based on facts, not absolute truth. There is a difference between absolute truth and facts, which I have discussed in my classes 2 years back, which I'm not going to take now. So if you see the reductionist concept of health, what is that affects the health or the vitality? We have these things in front of you: the diet, the microorganisms of the infection, the stress, the receptors in the body, the insulin resistance. I have just took a couple of examples over here. So these are the things which affects the health. But are these the things really affect the health, or is it restricted only to this much? When you become a naturopath, when you want to make a consultation for a particular patient, I really want everyone to try this particular thing. These many concepts are there that which affects your health and vitality. First one is your constitutional strength. That is your familial, genetical, and congenital, like how we are born. That is why we always say that whenever a couple is planning for their marriage, they're planning for their kid, as a naturopath, our job starts there. Having a healthy pregnancy, normal delivery, non-exposure to vaccines, continuing the person to expose well to the environment to get enough acquired immunity, improve the interpersonal relationship between the kids. And I was speaking to one of my friend, Dr. Boris today. So he's working in a developmental disorders clinic in Kanyakumari. So he was telling after pandemic, he's getting an inflow of a lot of kids with behavioral disorders or neurodevelopmental delay. They do not want to concentrate. They do not want to look at the face. It is what happened for this 2 years because of the diminished in familial, genetic, and congenital thing. This is going to be a definite part of your consultation. The second one is diet. Whether you're taking excess diet or a deficient diet. Exposure to fresh air, clean water, sunlight, and nature. How much time you spend in the sun. So let us do a survey among naturopaths now. I have not created a poll. I want to know that how much time you spend in sun a day. All of your doctors. Can you give in hours or minutes? Just put random numbers on how much hours you spend in the sun or in the nature or go to a forest. 1 hour, Dr. Shankar. Any time of the day, 20 minutes, 2 hours, 5 to 10 minutes, 3 hours, 15 minutes, half an hour, 10 minutes, 1 hour, 15 minutes, 25 minutes, 1 minute, 5 to 10 minutes, half an hour a day, 5 minutes. So this is a state of affair of so-called naturopathy doctors of us. Okay. So do we have to think no sun? Do we have to really think that we need to change this? Should this be an important part of prescription making and consultation, definitely it should be. And already I have discussed about the kind of lifestyle which we need to basically look into. Lifestyle doesn't mean that diet and all. Work, education, exercise, the satisfaction of you as your doctor or you as your patient, the recreation, what they're doing, the kind of rest, what they're taking, whether it's a rapid eye movement sleep or non-rapid eye movement sleep, all these matters in the consultation because you are going to treat holistically. Any injury or disease, if you are having any injury, you undergone a surgery, your gut flora has already been tortured and tormented. We need to understand what is the kind of toxemia levels in terms of external pollution and internal pollution. Internal pollution is not just the debris, the thought pollution. Health organs of detoxification, your liver, your kidney, your lymph, or the organs of elimination, the bowel, the gallbladder, the bladders, respiration, skin, emotions, and relationship. So we like now I have made my students in holistic department to implement this particular thing. If anybody comes to you for a consultation, I want to know from their childhood, what are the kind of emotional traumas, how happy they are with their husbands or wives respectively, or their in-laws, son, daughter, and things like that. How happy they are being a wife or being a husband, how happy they are being a boss. The emotions and relationships really counts. That is the individual factor. So all these things we are doing to try and find what is the individual factor. And what is the exposure to culture and creativity? When is the last time you have seen a full-length movie? Or when is the last time you stopped seeing news? I don't remember when I saw the news last time. I stopped it long back. I don't want to become an IAS officer, and neither I want to become a deceased person, or neither I want to become so worried that I'll get some disease. All this I'm speaking, I may get a heart attack. I may get a cancer. I may get a sciatica. All things I also get. It is all about what is the vitality in me. What is the kind of positive vitality, and disease is not a separate entity. Disease is going to be there. Philosophy, religion, and ethical life. What is their concept? What is the community and environment and the ecology from where they are coming from? Whether they use a lot of pesticide or less number of pesticides, how they treat animals, how they treat cockroaches, the social, economical, and political factors in their country. If you see, this is what is naturopathy. This is what comprises of naturopathy, and that is why the personalities like Mahatma Gandhi and all acquired naturopathy. It is not just because naturopathy is not without side effects. It is very, very philosophically rich concepts and system of practice. Imagine for a consultation to make, identifying all these factors in your consultation and trying and addressing each and every factors, linking each other in your consultation. You make a very different person. And you all know Sadhguru of Isha Yoga or Baba Ramdev or the so-called big saints who has thousands and millions of followers. Why they are having so many followers? Because they say what is being very fascinating for the people. And that is one component. It is not saying yoga is great or naturopathy is great, diet is great, acupuncture is great. We are not endorsing anything. The people are great. The person who is sitting in front of you is very, very great. We need to identify all these particular organs together, not in isolation. The political factors also can be a reason for a disease. Just for example, you need a vaccination certificate. How many of you are annoyed about that fact? You need an RT-PCR to join your college back, or to write an exam, to travel in flight, travel in train. Is it that annoying? That is a political force which is inducing a disease. Over a period of time, slowly you will become a LTTE or Taliban. I hope you are not becoming that. But I'm saying that these are the political factors. The sunlight, the lifestyle. So all these things basically should be covered while we are doing a consultation. I guess we'll stop here. This particular thing is a little more conceptually deep. So I'll take this from tomorrow. We have a couple of days remaining. I'll be explaining about the case taking, then a brief about prescription making, and probably we will take a couple of examples in terms of diseases, how we can holistically manage that particular disease. So all said and done, what I'm saying right now, I've told that you need to take all these concepts together. So you will be asking me, so what we have learned in our college, whether that is going to be not useful. It is definitely going to be useful. but we should know how to utilize that particular knowledge and treat a particular patient. So tomorrow we will see about the rest of case taking and how this is going to influence prescription making. And then subsequently, we also will see about when you get a disease in front of you, how not to look it as a simple receptor to receptor entity, and how to look it as a very comprehensive, large phenomenon, which is going to be the most individualistic to a particular person. I hope you enjoyed today's session, and hope to see you all tomorrow, same time by 7. Tomorrow we'll start sharp by 7. Thank you so much for patient listening, and it is so nice to see you 229 participants still remaining over here. Thank you.